Bienvenue sur Africa 24. Alors que des institutions internationales comme l'Organisation mondiale de la santé s'inquiétaient d'une hécatombe dans les pays africains au début des premiers cas de Covid-19, le continent a plutôt déjoué les pronostics au niveau du bilan humain qui était craint avec des taux de morbidité parmi les plus faibles par rapport à d'autres régions du monde. Au moment de la reprise économique post-Covid-19, Africa 24 décrypte l'intérêt d'initiatives prises sur le continent comme les usines de vaccins avec Solomon Quaynor, Vice-président chargé du secteur privé, des infrastructures et de l'industrialisation à la Banque africaine de développement. Une fois de plus, bienvenue sur Africa 24, Monsieur Solomon Quaynor. Si on peut se féliciter du bilan humain dans la lutte contre le Covid-19 en Afrique, peut-on en dire de même pour le bilan économique?
So first of all, any loss of life is too much. So we're not pleased really with the number of lives that we lost as a result of COVID. And this is one of the reasons that we're trying to make sure that we are better prepared for the next pandemic or the next epidemic. However, in the context of really the economic impact, the African Development Bank had a three-pronged strategy in terms of our support to government that included, one, improving really the healthcare preparedness on an emergency basis, two, providing safety nets for the most vulnerable people in society, and then three, providing really governments the ability to support the most vulnerable private sector, which is SMEs. And, across really all the countries that benefited from our crisis response facility, we've seen very good implementation of this, great stabilization of SMEs. And now we are more in a recovery period where the SMEs are building back their business. So I would say that overall we're quite happy really with at least the way in which the African Development Bank has supported its countries to stabilize its private sector during this tumultuous period.
Les premiers vaccins contre le Covid-19 à être distribués dans les pays africains sont surtout venus de la Chine, de l'Organisation mondiale de la santé et de pays occidentaux. Actuellement, des projets et des usines existent dans certains pays comme l'Afrique du Sud, le Maroc, l'Égypte, le Kenya, le Nigeria, le Sénégal et la Tunisie. A-t-on une vue des projets effectivement exécutés?
So we do have the project with Johnson & Johnson up and running in South Africa. And I would say that's the principal project that's really up and running and contributing really to the global supply of COVID vaccines. However, when we think about, implementing vaccine manufacturing in Africa, it's not only about COVID vaccines. It's also about malaria vaccines in the future. It's also about some of the routine vaccines. Only 1% of the vaccines we consume on a routine basis in Africa is produced in Africa. So this is what we're trying to change. So it's not only about COVID vaccines. And, yes, there are a number of projects up in the countries that you mentioned. But once again, we at the African Development Bank are looking at different ways to support both the manufacturing of vaccines, but also the transportation and logistics of vaccines, both in the near and medium term.
Est-ce pertinent de développer ces usines de vaccins anti-Covid-19 quand on constate que les gouvernements ont du mal à épuiser les stocks de dons de vaccins reçus pour vacciner les populations? En Afrique du Sud, par exemple, la marque Aspen a récemment annoncé un risque de fermeture de lignes de production en raison d'une demande faible.
So this is why we are really working with the African Union Commission as we take a look at vaccine manufacturing in Africa. It cannot be done on a country-by-country basis. It has to be done on a regional basis. In some cases even, vaccine production in Africa has to be part of a global supply chain so that the offtake is not only peculiar to the African markets. So this is why we will continue to work with the likes of Gavi and UNICEF in this process of localizing vaccine manufacturing in Africa. We would also look at different ways in which we can pool offtake, especially from the countries that are graduating from Gavi. So it's not really a simple solution to all. But once again, the lesson from really the COVID pandemic and the inequality in terms of vaccine distribution suggests that Africa should really have a minimum security of supply in terms of vaccine manufacturing.
Quelles infrastructures à privilégier pour permettre au continent de mieux adresser d'éventuelles nouvelles épidémies à l'avenir?
Absolutely, and this covers really several areas of infrastructure. I mean, definitely healthcare infrastructure is going to be important. And, we at the African Development Bank think about, our preparedness for the next pandemic or epidemic in terms of three ways. Pharmaceutical manufacturing, more so on the continent, vaccine manufacturing also on the continent, and the capability also to do some R&D, research and development, especially for our own routine, diseases. And then thirdly, it's really about healthcare infrastructure. The ability to do diagnostics can always, create a better awareness so that we know how to respond. So diagnostics, looking at, primary healthcare centers, prevention is always better than cure. Taking a look also at, secondary and tertiary, healthcare centers or clinics or hospitals is also going to be important. And we have to also work on the demand side. The ability to pay, insurance or otherwise, needs to be actually done in such an affordable sense so that we can really have universal healthcare coverage for our populations.
Que fait la Banque africaine de développement sur le volet industrialisation et pour le secteur privé de ses pays membres?
So we're doing a lot. But very importantly, we've developed a private sector development strategy as the AFDB, where we're looking to improve the business enabling environment in our countries. We're also looking to work with our countries in building out infrastructure. Not infrastructure really as an end to itself, but infrastructure that really underpins economic corridors, or infrastructure that supports what I call the enclave strategy. The enclave strategy is where we have the special economic zones, where all the necessary infrastructure to have the productive sector is also housed. So the whole concept around, the economic corridors and also, the building out of infrastructure is to really support Africa in its industrialization drive, to have greater value addition in the commodity areas that we produce competitively. And then lastly, it's about SME development, because SMEs really create jobs in Africa. 80 to 90% of the jobs created in Africa are really with SMEs. So we're going to really look at various industrial value chains, and we're going to support the SMEs in these national and regional value chains as well. And this is really what we're looking to do in terms of private sector development in our various regional member countries, especially focusing on industrialization underpinned by the African Continental Free Trade Area, which has the potential to really be a game changer. So we've supported the establishment of the AFCFTA Secretariat. We continue to work with them for them to really operationalize the Continental Free Trade Area as quickly as possible, because this would really speed up our recovery. Africa has to integrate economically. Africa has to integrate beyond economics. And Africa's integration, which we work on block by block, with really a lot of our projects on the infrastructure end, is going to really be key in speeding up a private sector-led economic recovery.
Monsieur Solomon Quaynor, merci d'avoir répondu aux questions d'Africa 24. Merci d'avoir suivi ce décryptage. Restez sur Africa 24 pour les prochaines éditions.